Good evening, and thank you for joining tonight's community conversation hosted by the City and County of Broomfield. My name is Roger, and I'll be your moderator this evening. Presenters tonight include Mayor Pat Quinn, Mayor Pro Tem Guylene Castriata, Councilmember Stan Jezierski, City and County Manager Jennifer Hoffman, and Public Health Director Jason Bowling, along with Broomfield staff who will be able to answer your questions throughout the evening. Before we begin, I want to take a moment to tell you about the format for tonight's interactive call. We realize some may just want to listen, and that's perfectly fine. But for those of you who would like to ask a question, we encourage you to please press *3 on your telephone. You'll then be transferred to an operator who will take down some basic information. Once the operator notes your information, you'll be returned to the call and can listen to the conversation until it's your turn. So go ahead and press *3 now if you already know your question, and follow that same process throughout the call tonight. If you hear something that generates a question, please press *3. Now, we'd like to hear from as many of you as possible, so we'll limit you to 3 minutes to ask your question. And when it's your turn, I will call your name and ask you to repeat the question for our live audience. And also a quick note to both panelists and community members asking questions, please speak a little more slowly than normal and clearly, as this year's telephone town halls are being translated live and streamed live in Spanish. And if you are listening and would prefer to listen on the Spanish line or ask your question to our moderators in Spanish to translate for the entire call, please call 855-543-3424. It's now my pleasure to turn it over to Mayor Pat Quinn for some opening remarks. Mayor, go ahead.
Thank you, Roger. Good evening, everyone. This is Pat Quinn, Mayor of Broomfield. I want to thank each of you in calling in tonight. Every month, I'm humbled and impressed by the number of you who do call and continue to call in, and by the thoughtful questions and comments you voice each week. There is much to celebrate this month, from my Madeline's 16th birthday to moving to the far less restrictive level blue on the dial and hosting mass vaccination events in our own First Bank Center. It's clear things are looking up in Broomfield and around the nation. I do want to stop for a moment and tell you that I'm thankful that Derek Chauvin will be held accountable for the murder of George Floyd, but I want to state my personal feeling that this is just one step, an important step towards justice for all. There's still much work to do. The time is now to continue coming together, to trust one another, to build bridges with each other, and lay the foundation towards a more safe, equitable, and inclusive community for all of our residents. Let's do it together as one Broomfield and one community committed to each other and our collective future. Now, before we start taking your questions, I'll turn it over to Mayor Pro Tem Guylene Castriata. Guylene?
Thank you very much, Mayor. This is Mayor Pro Tem Guylene Castriata. I'm confident that this Broomfield community can come together and build a better future for our next generations. The way in which we came together in the face of this public health and economic crisis gives me great faith that we can take on this hard work and journey together and come out stronger and more united. I'm proud to report tonight that I am now part of the 63% of Broomfield's population who are fully or partially vaccinated. This is an incredible feat and only possible thanks to each of you who got the shot. Broomfield is leading the way towards community immunity. The ride has not been easy, but our battle against this virus, we're not off the roller coaster yet. We're facing a fourth wave of increased positive cases. We are seeing a higher than ideal positivity rate, and we have thousands of neighbors yet to be vaccinated. So we must stay steadfast in our battle and hold on just a little bit longer, because the good news is we know how to do it. Follow the 4 W's. Wear your mask, wash your hands, watch your distance of 6 feet, and wait just a little bit longer on large gatherings. Get tested if you have symptoms or think you might have been exposed. There are over 80 free testing sites in Colorado. And please, if you haven't scheduled your vaccine appointment, do it now. There are many available openings at local pharmacies and clinics around Broomfield. Find testing locations, vaccination appointments, and more at broomfield.org/COVID. Now I would like to turn it over to my colleague, Councilmember Jezierski. Stan?
Thank you, Mayor Pro Tem, and thank you, Mayor, for having me here this evening. I do appreciate it, and I also want to thank all of our citizens and folks that are listening in here tonight. I want to start by reiterating what our mayor just previously said, that there is a lot to celebrate this month and going forward. And for me personally, I'm looking forward to the warmer weather, being able to get outside on my favorite hiking trails. And as the Mayor Pro Tem mentioned, vaccinated. I will be getting my second shot this week, and really can't wait to have my mother visit this May. It'll be the first time that I've seen her in person in well over a year, probably closer to 2 years. So a lot of things. I'm also looking forward to getting our local businesses back to normal operating levels so they can sustainably serve our community. As a business owner myself, I know we have been through the ringer this year, with stay-at-home orders, mask mandates, and ever-changing state capacity limits. And they've made every day a struggle. But as you've heard, the good news is, we are close to the end. And I know what it feels like. We've been on this long road trip. And right now we're in that final stretch, where the snacks are gone, the kids are restless, and you want to pull over, but you know what? It's too close, and you can't stop now. So, I've been there. I have 4 kids, and I think a lot of us have been there. And we're almost there to the end. So just keep trudging forward just a little further. Now I do want to mention for those businesses that are still struggling, I am pleased that the mayor and city council continue to fund small business grants through the enhanced Broomfield program. And I want to wholeheartedly encourage all Broomfield businesses to apply. And if you've applied once, and you're still struggling, apply again. We still have over $233,000 in funds available to help Broomfield businesses. So, there's help out there, there's support out there. If you still need it, get in contact with one of us here today. Get in contact with our business development. I always forget what they're called now, but Jennifer could help us with that. And there's support out there. So, I'm sure I speak for many when I say Broomfield, wouldn't it be the same with our beloved businesses, both the local businesses, the franchises, and some of our large corporations. It's what makes Broomfield special and unique. And we certainly, we need them all. We need you all to be here this summer and going forward. So, it's been a tough haul, but I think we're there and looking forward to brighter days ahead. So with that, I will turn it over to our city and county manager, Jennifer Hoffman.
Thank you, Councilmember Jezierski. I too share your optimism about what we are ready to embark. I think our entire community, although resilient and strong and healthy and supportive of one another, all of us are eager to return to really being able to see family. As Councilmember Jezierski said, I think it all really, it makes it tangible for us to be able to say, with that one key of having our families back in our homes, not having to sit on our porches and have conversations with them on the sidewalk. So I think the level of optimism is increasing exponentially week by week. I want to reiterate what Mayor Pro Tem Castriata had indicated. We just need to hang on a little bit longer, that it will serve us well. We're continuing to invest in our future so that there is not, in fact, a rebound. And our Director of Public Health, Jason Vaughn, is going to talk a little bit more about that. And as the mayor had indicated, we have a lot of staff on tonight to field any questions that you all may have. And Councilmember Jezierski, it's economic vitality. So if you pull up broomfield.org, enhance Broomfield, or you can call our main number, 303-438-6300, and we'll get you hooked up. Our businesses are really our lifeblood of our community, and we take your assistance seriously. Jason, talk to us a little bit about where we are.
Yeah, thanks, Jennifer, and thank you, Mayor Pro Tem, and Stan, with your thoughts. And just want to thank everybody for joining us tonight. Again, I'm Jason Vaughn. I'm the Director of Broomfield Public Health. And by May, we're hoping to reach that 70% of our community vaccination rate to start to get to that community herd immunity. And as we get more of our folks 16 and older vaccinated and continue keeping our residents out of the hospital system, we're seeing the end in sight. As a metro region of counties with shared borders and workforces, the metro area public health directors are working together to get us there in a couple of ways. First, we issued a public health order requiring face coverings for indoor spaces to reduce the transmission from one household member to another. Data and the evidence is very clear. It shows that masks are a critical and effective tool to slow the spread. And we don't want to go backwards with that anytime soon. Then the public health directors came along to release a simplified version of the dial to usher us through a phased reopening while vaccination efforts are ongoing. Starting on April 16th, this new public health order in simplified version of the dial moved Broomfield from level yellow to a less stringent level blue. From there, assuming hospitalizations continue to remain at manageable level, Broomfield plans to move into level clear, which that's an observational period from May 16th to August 16th, which will allow businesses to operate at 100% capacity. This is an important milestone in the long war against the novel coronavirus. But I will say, we wouldn't have been having this conversation if it wasn't for all you are doing on your part to slow the spread and get vaccinated. By getting the shot, you're not only protecting yourself, but also your loved ones, your neighbors, and your children, who are either unable or not eligible to receive the vaccine themselves just yet. Also, to find a vaccination site near you, visit broomfield.org/COVID vaccine. Again, that's broomfield.org/COVID vaccine. On behalf of all of us, we look forward to your questions and thank you for continuing to call in. Roger, back to you.
All right. Thank you very much. For those of you that joined us late, good evening. I'm Roger, your moderator tonight for this community conversation hosted by the City and County of Broomfield. We have Mayor Quinn, Mayor Pro Tem Castriata, Councilmember Jezierski, and all sorts of staff standing by to answer your questions. You can participate in the discussion by pressing *3 on your telephone. You'll be transferred to an operator who will take down some basic information and get you in the queue. So that's *3 on your phone to ask a question. And we are going to start with Karen. Karen, go ahead.
Yes. With the positivity of the COVID virus in Colorado getting higher, what is so important about the economy over human people's lives? I was doing daycare in my home. Okay, I lost my clients because they lost their jobs. The government is not really helping us. They gave us a $1,400 check. Most of our rent is $2,000, anywhere from $2,000 up. I mean, do they really think that that's going to help us? And also, how are we going to give our kids back in school when they don't have a vaccine? I'm concerned. I have grandchildren. They don't have a vaccine for the children, and I'm afraid to send my kid back to school. Why would you send children to school with no vaccine. And I understand that businesses are important, sir, but you won't need businesses if people are dead.
Thanks, Karen. And first of all, I can hear the concern in your voice, and we as public health professionals have had that same level of concern throughout this entire pandemic. And I would say even our City Council and Board of Health has been there with us. One thing we've done throughout this process is use public health data to drive our decisions. And as we are looking at where we're at right now with the virus and where it's heading, a lot of the data is showing that we hope to have the majority of our eligible populations vaccinated by May 21st here in Broomfield. That'll create a lot of immunity and protection for our residents. In addition, Pfizer is going through the process of clinical trials on vaccines for those age 12 and older. And so we do look forward to that being reviewed by the FDA, and hopefully we can start issuing those vaccines in the near future for our children. The last thing I would say is we are definitely looking to continue to prevent severe illness and death throughout this entire process. And the COVID vaccines have been proven to be highly effective in reducing both hospitalizations and deaths. And as we go through this next month, that was the point of giving us time to continue to get the vaccine out to our 40 and under population in order to position us well to move to that level clear. I do want to say when we are in that level clear, we'll continue to monitor the hospitalizations and deaths closely. And if we start to see things go in the opposite direction, we do have the ability to move back. But my full expectation is, based on the trajectory we're seeing right now, we just need to hang on again for this next month, make sure we're all continuing to follow the public health guidance that's out there. And if you can, please encourage your friends, your family members, anybody that you're in touch with to get the COVID vaccine. That's what's going to get us out of this. Thank you.
All right, again, if you'd like to ask anyone on our panel a question, press *3 and we will get you in the queue. Next up is Rich. Go ahead.
Yeah, my question has to do with the senior center and the lunch program. We've been Broomfield residents now for over 45 years, and it appears to me that May 16th sounds like a good date to open the senior center for lunches. Most of the seniors, I'm sure, are not all vaccinated.
Hi, Rich. Clay Shuck, Director of Parks, Recreation, and Senior Services. Thank you for your question. We are currently working on plans. Actually, we have a meeting tomorrow to talk about the congregate lunch program and how to get that back up and running and people back in the building. As you know, for the past year, our Meals on Wheels folks have also been working really hard in delivering meals out, so we appreciate all the work that they have done. But we are looking at what it looks like to get those meals back up and running. So thank you very much for your question.
All right, thank you. Beth is next. Go ahead.
Hey, good evening. I was wondering what the current positivity rate for it is around the Broomfield area hospitals, and why we go with the positivity rate versus the hospitalization rate. I work at a major Denver hospital, and we have almost just a few people there. I mean, it's so low, it's almost nothing. So we talk as if we're in this big emergency, but really the hospitalization rate is so incredibly low. So I just wanted to know what Broomfield area hospitals was.
Yeah, it's a good question, Beth, and I'll start out at a high level and then let Deb jump in with the current hospitalization numbers. we still are tracking our case numbers and percent positivity because that just demonstrates how much virus there is in the community for the unvaccinated populations. And again, we do know that those that are unvaccinated, we're seeing hospitalizations occurring more in the younger populations. And so we'll still continue to track the cases and percent positivity, but we are moving to looking more at hospitalizations per 100,000 over a 14-day period and see if we see that consecutively. And that gets exactly to your point to say, are we seeing hospitalizations going up dramatically or not? And again, if we're not seeing that, we feel that we're in a place where we can start to move towards putting out strong public health guidance and relaxing our public health orders. And Deb, if you want to address the specific question about hospitalizations and percent positivity.
Sure, thanks, Jason. This is Deb in Public Health, and you are correct that in Broomfield, our hospitalizations have remained stable. In the Denver metro area, there has been an increase in hospitalizations over the past several weeks. But as Jason said, that we really are at this stage looking at severity of COVID cases. And so you are correct, hospitalizations is a measure of that. And because we have not seen those increases in severity happening in Broomfield, that is why we are moving to a less restrictive phase. And hopefully, as we continue to see vaccination rates increase in Broomfield, we'll be moving to level clear in a few weeks, assuming that these trends continue. Positivity rate is 6.3%. I'm sorry, I don't know if that was one of the questions, specifically what it was. So that is anything above 5% is considered higher, but we are looking at all metrics, including hospitalizations. Thank you.
Jennifer, I think we were going to have you jump in and talk a little bit as we start to see things open up. Maybe you can talk a little bit about what you're seeing in the city and how the city and county is starting to think about next steps in opening.
Thank you, Roger. I sure appreciate it. It gets a little bit back to the gentleman's call with our back to our meals in our much anticipated beautiful lakeshore room at the BCC. So CCOB has been closed. Our employees have been at home. As most of you know, we're open on an appointment basis only, beginning on Tuesday, June 1st. Employees will be coming back. The doors will be open, which means the public will also be coming back in. From a staff perspective, you can never get accustomed to having it be so eerie in those hallways. So I know that I speak for all of our staff that we're eager to bring folks back and to begin opening up those services. Again, that's June 1st, which is a Tuesday. The mayor and Mayor Pro Tem and council have also indicated that beginning in June, we will be back in person for our council meetings. So just another piece of Council Member Jezierski's optimism on seeing everyone and reconnecting in person, and that includes the BCC opening, which will include the Lakeshore Room as well. And for our seniors out there, we're really excited for you all to be able to come to your new home and make it comfortable and adjust and modify. We're really eager for your feedback on that and what that looks like. So thanks, Roger. I sure appreciate it.
All right, that's some great news there. Thank you. If you have a question for anyone on our panel, please press *3. We'll get you in the queue. Next up is Shannon. Go ahead.
Yes, hi. Thank you for taking my question. You mentioned we'll move to I think it's a clear status through August 16th. And I'm curious as to why there's an end date on a future status.
I think I get your question, Shannon. And as we move again from level blue to that level clear, we established a month period of time just to see what happens as we're in this level blue phase. And again, unless we see variants take off, which we are not seeing with our vaccines happening, there's sort of the race of the vaccine against the variants, and right now they're continuing to somewhat level off each other across the state, and we're seeing in specific communities when they have higher vaccination rates, the cases are starting to drop, and we're hoping to see that occur in Broomfield in the near future. The second thing is why we had that 3-month period based on projections. The idea behind that was we just wanted to ensure that we had an ability to continue to see what happens with this novel virus. I think one thing we've learned throughout this entire process is we can make the best data and decisions, but the virus has thrown numerous curveballs at us. And so it was an opportunity for us to monitor over that 3-month period. And if we see at that 3-month period that additional steps are still warranted, we would have that conversation, obviously, with our city council and our board of health. I appreciate your question. Thank you.
All right, great question so far. Again, *3 to get in line. We're going to go to Jennifer next. Go right ahead.
Hi, I was asking the question, is the bay going to open? Is one of my questions. The second is being around people that are non-vaccinated by choice. There's a lot in the department I work in. Is how's my safety, or should I do anything different? But they're choosing not to get the vaccine and so far won't.
Hi, Jennifer, Clay Shuck. I'm going to take the first part of your question about the bay, and we are happy to announce that we are planning on opening the bay starting on June 1st. And we look forward to bringing that operation back and really serving the community and seeing the kids and the families get back out and enjoy that wonderful amenity. The second part of your question, I'm going to turn over to Deb Fettersfield.
Oops, sorry, I was slow to unmute there. This is Deb in Public Health, and thanks, Jennifer, for the question. And so one of the best things that you can do to protect both yourself as well as others, unvaccinated individuals around you, is to receive the COVID vaccine. And so once you've been fully vaccinated, so that is 2 weeks out from your final dose, you have immunity. And now that we have more and more of the population vaccinated, we're able to confirm that the COVID vaccine is highly effective. It obviously was tested before, but we've seen in Colorado a dramatic reduction in cases as a result of individuals being vaccinated. So all of the vaccines in use are highly effective, and that is going to be your best protection. So if you do come into contact with other unvaccinated individuals, you yourself have a very low risk of becoming ill, as well as a very low risk of transmitting the disease yourself or the virus yourself. So we are really encouraging individuals to consider vaccination. There's a lot of opportunities to do that here in Broomfield and around the metro area. Jason mentioned earlier, there's a website, broomfield.org/COVID vaccine. You can also sign up for text messages. You can text CCOV to 994-11 if you want to be alerted when there's opportunities for COVID vaccination. And I think too, we understand that a lot of people still have questions. There's information they need to have, trying to find a vaccination site that works with their schedule. And so I think the good news is we're at a different place than we were even a few weeks ago. There are a lot of options, evenings and weekends. And so if people haven't just been able to figure out how to get there with their schedules. I think there's certainly more options. And then again, if individuals have questions about the vaccine, need more information, you can find that information on our website as well, also on the Colorado Public Health Department's website. So finally, publichealth@broomfield.org is always a resource if you're not finding the information that you need. So thanks for asking the question, and we encourage our community to continue to take advantage of the opportunity to become vaccinated to protect both themselves and others. Thank you.
Roger, could I just add one more point to that? Because I think Deb's point was extremely important. At this point in Colorado, anybody 16 and over is eligible for the vaccine. And we're starting to get to this place where we're seeing the supply is definitely meeting up to the demand. So we strongly encourage anybody in Broomfield that is looking to get a vaccine to visit our website and find a provider. And anytime if you're struggling, you can always reach out to the public health department, and we'll do what we can on our end to make sure that we can connect you up to get a vaccine. We're no longer in that place of scarcity, but in a place of being able to get people in. So please spread the message to, again, everybody 16 and over, that vaccines are available, and there's numerous sites out there to be able to get it.
All right, thank you, sir. We're very pleased tonight to have Susan Bellis with Mental Health Partners join us. It's been a tough year on so many fronts, and mental health is one of those areas that have really been challenging. Susan, do you want to talk a little bit about what services might be available to folks that are struggling?
Sure. So we predominantly serve folks who have safety net insurances, Medicaid, Medicare, and also funding through our own county and cities, which we super appreciate. So we can help folks who don't have any insurance. And we also, there's a statewide crisis line that anyone can access. And we have a walk-in crisis center that anyone can go to. The last month since the shooting in Boulder, we've been a big part of the response and the recovery program that's offered services to the victims of that, as well as first responders, anybody who was in the plaza. And in the next year, we just rented a building, and we will be taking over supplying the Boulder Strong Recovery Center. And I know we're Broomfield, but we all, I think, have been greatly impacted by that. And many of us are connected to that community as well. And so that will be a resource that anyone in the future will be able to access. We've been providing some free support groups for folks right now. So our general line is 303-443-8500 if anyone needs services or has questions, give us a call.
All right, thank you, Susan. If you didn't have a pen handy, we'll repeat that number in just a few minutes, so grab a pen and paper. Let's go to Larissa next. Go ahead.
Yes, hi. I wanted to ask, well, I think now I want to ask two questions if it's okay. The first question is, are we going to have the July 4th fireworks on Broomfield Commons this year? And the second one is, I'm not sure I understood when or if there's a plan for when children under 16 will be able to be vaccinated.
So, hi, Larissa. Clay Shuck. I'm going to take the first part of your question. Currently, city and county staff are working on a 4th of July celebration, again in Commons Park. So we look forward to that as long as we continue to move forward. And again, we would encourage people to continue to sign up for vaccinations if they haven't done that. On the second part of the question, I'll turn it over to Deborah.
I can take it. Yeah, I'll take it, Clay. Yeah, for the second part of your question, as I mentioned before, Pfizer is currently testing their vaccine in the 12 and older population that's going through the final steps of clinical trials. It'll be submitted to the FDA, and we don't know the definitive timeline of when it will be available, but we're hearing sometime potentially in late May to early June. So we hope at that point the vaccine will then start to be distributed to us to get out to our younger populations.
All right, thank you. Let's hear from Dave next. Go ahead.
Yeah, I was wondering when the 16th comes along and we move to a level clear, hopefully, is the Broomfield public health order going to go away and that guidance go away, or are we going to have new guidance coming out from Broomfield? Just curious about that.
Yeah, excellent question, Dave. When we move to level clear, we'll still have a public health order in place, but we will no longer have those capacity restrictions. Level clear is just strictly an observational period under the order. And again, if we start to see dramatic increases in hospitalizations, we would then look at potentially moving us back to a level blue or a level yellow. Based on the numbers we've seen as far as hospitalizations in Broomfield, if we continue with our vaccination rate, I don't anticipate that would happen unless we saw a unpredictable variant start to take hold.
All right, thank you. If you have a question, *3. Here is the number for Mental Health Partners in case you didn't have a chance to write it down. That number is 303-443-8500. And the crisis line statewide is 888-493-8255. 888-493-8255. We're going to go to Ken next, and if you have a question, press *3 to get in line. Ken, go ahead.
Yeah, so every time I turn around, I'm hearing about different variants of the COVID virus. I'm fully vaccinated with both Moderna shots, and I know a lot of people have had the Moderna and the Pfizer. I'm hearing about a third Pfizer possibly coming out. And how sure are they really right now that the Moderna and the Pfizer are going to take care of the variants that are out right now? What's their confidence level? And do you think they're really working on a third shot? And when would that take place? A year down the road, 6 months down the road? Or does anybody really have an answer to that question?
Yeah, Jason here again, Ken, and great question. So with the variants, we are currently, the state, I should say, is testing for all current variants and all new variants through genomic surveillance. And that's basically the state lab going through all of the genes to see what variants are out there. The current predominant strain of the variant, the B117, here in the state, both of the vaccines have been shown to be highly effective against that. And so that is definitely the positive news. Regarding Pfizer working on, or other, Moderna and others working on an additional vaccine, there's a couple things they're looking at. One is, when does immunity potentially wane once you do get the vaccine? And they're still gathering more data on that. But the idea behind it is we may need to have a booster shot as part of this to keep our immunity levels up. And it would be similar to any other booster shot you get as a vaccine to make sure we keep that same level of protection. The other thing they're doing is they're closely watching the variants, and if they start to see that the vaccines aren't working against a specific variant, they're looking at how can they modify the vaccine. And thankfully, it's not extremely complex process to make sure that it works against these new variants. So I think it's a twofold process. One is that they're working to look at how do we just get booster shots in general in the future to keep that immunity level high. And then the second one is preparing for if there are variants that the current vaccines don't work again, that they have those vaccines ready to go.
All right, thank you, Jason. Again, tonight's community conversation is being hosted by the City and County of Broomfield. We have Mayor Quinn, Mayor Pro Tem Castriata, and Councilmember Jezierski online, along with a whole bunch of county staff. So please press *3 if you would like to ask a question. You'll be transferred to an operator who will take down some basic information. I'll also mention that we've got maybe 19 minutes left. If you don't want to speak with an operator, or if you need to leave a call early, you can leave us a message by pressing *9. So press *3 to ask a question or make a comment. Press *9 to leave the call, and also leave a voice message. Let's now go to Jennifer Hoffman, and she may hand this off to some of her team. We're going to provide a couple updates on programs that we're so happy are coming back to the city. Jennifer, go ahead.
Thanks again, Roger. Catherine Lineup, our Director of Library and Cultural Affairs and our museum. We have some really cool programs that are coming up that we're pretty excited about. Catherine, tell us about a few of those.
Hi all, Catherine, this is Abby Yellman. Catherine is actually joining. She had a technical difficulty, but she's jumping on right now.
So quickly,
All
just
right, well, while we're waiting
to
Catherine to get back on, I'll remind you again, press *3 and we'll get you in line to ask a question. Go ahead, sorry.
Oh no, that's fine. I was just going to fill a little bit of this time. We're going to be adding to the main screen so that folks we'll say it one more time before we leave. We all understand the pressures that COVID has caused. We have a lot of wraparound support services. We have two fabulous providers that are serving the City and County of Broomfield, mental health partners. You were a little from Susan earlier today. We have Community Reach. Both of them are located in Broomfield. Mental Health Partners just opened a really beautiful building off of Highway 287. And Community Reach is in our Health and Human Services building. And although they've been seeing folks again starting on Tuesday, June 1st, those doors are completely open again. So we'll be sharing that contact information, website, and contact the telephone number before we end tonight. And Catherine, tell us about some of those great programs that you're doing for our community.
Yes, so we've got a couple of things coming up. One thing is the summer concerts by the lakefront are going to start here in a little while in June. We do have a program this Saturday as well with our museum program. And that one starts at 2 p.m. and we do have some tickets left. It's called Looking Forward to Look Back. And it will be a gentleman talking about his experiences in Broomfield with housing and also with racism. So that one is coming up, and then summer reading program kicks off in June as well. So those are a few of the things we have coming up.
All right, terrific. Let's get back to calls. Again, *3 to get in line. Lindsay is next. Go ahead.
Hey there. Thanks for taking my call. So when you Google Colorado COVID stats, 62 of the 64 counties pop up. Denver and Broomfield missing. I noticed from a quick search that they are both two of the counties that have consolidated city and county governments. I'm curious as to why we cannot be included in that. It's reported by the New York Times, and how we can be included in that to be able to have that side-by-side comparison with other Colorado counties.
Hi, Lindsay. This is Deb in Public Health, and I don't think I'm going to be able to answer live in terms of why. I think we're going to have to look into that website that you just referenced. But what I can tell you is that we do share all of our COVID data, whether that's our cases, demographics of those cases, testing rates, positivity rates. We share vaccine rates broken down by age, race, ethnicity. So there's a lot of data on our website. If you go to broomfield.org/COVID, and then you can click on data, that's probably the most streamlined way to get up-to-date information. We update it daily. And if you have follow-up questions, you can always email us publichealth@broomfield.org. But I'm not familiar exactly with if you Google the Google COVID stats. I'm going to have to look into that, and I won't. If you email us at publichealth@broomfield.org, we can try to answer that question. But in the meantime, I really suggest going to our website for the most accurate, up-to-date information on Broomfield COVID data and information.
And we may have misunderstood your question, but I just typed in COVID stats in Colorado, and they start out with the New York Times, but as you scroll down on the page, you can see Broomfield a little bit lower on the page. So maybe it's the search term that's being used, but COVID stats or data in Colorado and Broomfield does come up. So I hope that does address your question.
All right, let's go to Sally next. Go ahead.
Hi, I'm Sally Huffman, and I'm calling to, first of all, ask what the status of Broomfield Days might be. And then also my other comments are just that I would like to thank the City of Broomfield and Jennifer and Clay and Nikki and all these wonderful people that are working at the new community center to make things really wonderful for the seniors once again, and for, you know, understanding our situation and taking really good care of our seniors here in Broomfield. So those are my comments and thank yous. And I guess my only question is about Broomfield Days.
Sweet Sally, it's Jennifer. Clay and I were gonna thumb wrestle for who got to answer your question. First, let me just tell you how wonderful it is to hear your voice. It renews my faith in moving forward. I'm so excited to see you, and equally excited to talk about Broomfield Days. Yes, I think the entire staff, Clay and his crew, have been gearing up for a really terrific and very special Broomfield Days. So you can absolutely plan on that and all of those accoutrements that come with it. Clay and I have been communicating about, generally we have 15,000 that show up for Broomfield Days. This year, I would certainly anticipate that number to double, I would think, over those 2 days. Just a great opportunity for us to reconnect, and we'll be working as usual with the Broomfield Chamber to have our kiosks. I know the council is super excited for Broomfield Days. We will also be having a special memorial and recognition for our community members that we have lost to COVID. We're continuing to work on what those plans look like. Marty Dormish from the Refuge has continued to spread kindness and love through Broomfield. We'll be working in partnership with Marty on a memorial. and culminating with Broomfield Days, starting with the 4th of July, of course, with those fireworks that long awaited and very eager for a visual recognition of the direction that we're going in. Thanks, Sally. I hope you and your family are doing well.
Thanks, Jennifer. Let's hear from Amy next. Go ahead.
Thank you. I just wanted to ask regarding the library, do we know if the statewide borrowing program prospector is going to be available again soon? I know it's been missing from the website and sometimes greatly missed. So I just wondered if we had information on that.
Hello, Amy. This is Catherine, Director of Library and Cultural Affairs. Thank you so much for that question. We are working as a consortium to try to arrange for that to be back in 2022. We are negotiating some pricing on that. And I'm also looking at if the consortium can't get that straightened out, that we could possibly join as a single library. So we are looking at options, and I feel fairly confident that we can again offer that in 2022. In the meantime, we are trying to supplement the loss of that really excellent program with interlibrary loan, so we can still get the titles. It does take a little longer, but we can still do that for Broomfield residents through 2021. So thank you so much for your question.
All right, thank you. Let's remind you one last time, if you have a quick question, you can press *3 on your telephone. And Jennifer, I'll just kick it back to you to see if you've got any other interesting news that you'd like to share before we close out tonight's community town hall.
No, other than to say again, we are thrilled to have get back to business as usual, connecting and integrating and communicating and moving our really beautiful community together. And much appreciation for every single one of our residents, particularly our kids, our youth. They give us hope for the future. How they have been able to endure and come through this is a really remarkable feat and serves as such an example for all of us adults. And with that, I'll turn it back to the mayor for his closing and goodbye.
Thank you, Jennifer. I guess I wanted to make a comment that, on behalf of myself and I'm sure council, we are thrilled to know that we're going to be back in session. I think, Jennifer, we've agreed it'll be the business meeting on June 8th, that council will be back in session, and it's tougher. Politicians by definition are people. And so it will be nice to be able to see our fellow council people and work together. So we're thrilled that there's a normalcy that's here, and hopefully we'll progress to absolute normal, certainly by July 4th. So on behalf of myself, Mayor Pro Tem Castriota, and Councilmember Jezierski, I want to thank you all for participating in tonight's community conversation. Our next regularly scheduled resident community conversation is Thursday, May 27th at 7 p.m. Residents are encouraged to engage with us by calling 855-695-3744 or through Channel 8 or via live streaming on Broomfield's website, broomfield.org. Thank you for all being with us tonight. Roger, back to you.
Mayor, thank you so much. It's always a pleasure to work with your excellent team, and we appreciate all the good comments and questions tonight. On behalf of the entire panel, we wish you a good evening and look forward to speaking to you next month. Good night.